Hi guys, it's X. Welcome back to my channel. In today's video, we are going to be talking about precepting students, tips for precepting students, and things you should and should not do. I am currently in my second to last preceptorship for my nurse practitioner program, and this is actually for nursing students, not nurse practitioning program, but I've experienced some things that I just definitely wanted to come talk to you guys about, and from experience, just making sure that we are giving our students the most best opportunity that they can have and learn from in the little bit of time that we have with them while they're in clinical. Another thing is that since COVID kind of ruined 2020 nursing students' experience, because either they didn't get enough exposure, or I had a rule at my hospital where they couldn't go into the isolation room, so they definitely lost some exposure there. But anyway, if you want to see my tips, just keep on watching. But before you swipe me away or click me out of this video, please like, comment, and don't forget to hit the subscribe button. Thank you. So my first tip is I always take students. I'm always very welcoming to them. When I see them walk in, I get excited. I love precepting and teaching students. And not only does it help them, but it actually helps me stay on top of my game and knowing things, because I have to teach them. So if I don't know something, I can look something up, and I obviously want to give them the best experience and the best day. Because I remember going to clinical and kind of not knowing what to do and just standing around sometimes and being like, what do I do? And my clinical instructor always told me, you're gonna get out what you put in. So I was very active in nursing school and seeking out opportunities and trying, hey, any Foley, any NG tube, anything that I can do, can I please try? And so I think about that when I get a student. I always ask for them, because I know there's a lot of nurses out there who don't like to have students. One thing I will say is that it does slow me down. It does make me prolong my day. I've never gotten out late, but it slows me down in the sense that I have to stop and kind of explain every single thing that I'm doing and why I'm doing it. But I think that is the best part, is you want to teach these students how to critically think. So in order to do that, you do have to sit down and explain why we're doing what we're doing, not just tell them what we're doing. I thought it was funny because I worked at the busiest, and I mean busiest, trauma center in the whole, I think, world. And it wasn't always in the ICU craziness codes. There were days where it was slow, and then there was days where I got rocked. My going home, I was so exhausted. 3 days in a row just killed me. And then there's days where I just sit there and feel like I've done nothing. So when I started precepting a student, I did 235 hours in, I think, 8 weeks. He was very motivated. I told him the first day, I don't want you to get your hopes up, but just so you know, the ICU's not always crazy busy. There's not codes all the time. So please keep an open mind, and I want you to realize it's not always going to be like that, because that's what I chose ICU. I love the craziness, I love the adrenaline, and that is why I chose the field that I work in. And it's just not always like that. However, I guess I jinxed us when I said that, because every single day that I was with him for the first month was just absolutely craziness. But one thing that I did for my student, and he had the best experience, I think he even got a better experience than I did in my whole 6 months that I was in the ICU when I was in nursing school, was I actively sought out every single opportunity that he could have. So anytime there was a procedure, whether it was a trach insertion, EVD insertion, coude, PEG, if I didn't say that, I made sure he went. I went and asked the surgeon, can he be here with you? I mean, he got to see paracentesis, I think thoracentesis. He got to go to the OR with one of our physicians because I begged, can he please go? And he got to go. And then I was jealous because I've never even gotten to go to OR with a patient before. So I think that is the best thing that you can do, is that when you first, I have 18 beds in my ICU. There's a lot of nurses that I work with. So the first thing I did every morning was like, hey, I have a student with me. Please let me know if you have any type of procedure to do today, so that he can do it and he'd practice it. And by the end of it, I told him, like, you are going to be great at OG and NG tube insertions. And my manager actually even stopped him and told him, because he put an OG tube in on an intubated patient who was laying down, and he got it in the first try. And she was like, I'm actually very impressed. It's hard to do, and it's not like, you know, you can tell the person swallow because they're intubated and sedated. So she was really impressed with that, and I was very excited for him because of it. But he had the best experience because of it. Another tip that I have, and I've experienced this, and I'm a very nice person. I'm very sweet and approachable, but when you come at me wrong, I think like anybody, like I go into attack mode and I try to keep quiet because my mouth has gotten me in trouble so many times. However, I just don't like when people are condescending or when they try to play mind games with you and make you feel stupid. So I never do that with my students, and I have experienced that in the past, unfortunately, from other nurses who are like, how long have you been a nurse? Or how have you never done this before? Like, those are things that are just, I feel, are so offensive to ask somebody. If it's questionable, if I ever feel like, this person really have this much experience, like I just internalize it, just keep it to myself. But I've never actively like tell someone that. I find it really rude and condescending. And if you already see that this person is lacking experience, why would you further make them feel like crap, essentially, and ask them these questions? It's discouraging, it's not encouraging, and it's not constructive criticism. And it doesn't matter how long this person has been a nurse, a student, or how long they have been in their program. Every single program is different. One thing that I always used to get asked, and I find really such a stupid question, is when you ask a student, what semester are you in? Why does that matter? If they're in the ICU, I assume they're in their 4th semester, because usually most nursing schools wait to the 4th semester until they send them to ICU. But every school that I have encountered, including my own, has different things that they teach at different times. When I was in nursing school, we started to learn how to put IV insertions in this little like toy box, like on the computer program. Like, I don't want to say toy box, but it was like this little fake arm, and it had like a mechanical IV that you guide on a computer screen. So that's the first time we started trying. We practiced on that, then we practiced on, you know, the fake arm with the pumping of the blood, and then we proceeded in 3rd semester to actually place IVs. However, there's other schools that I have worked with, their students, and they didn't put IVs in until the last 8 weeks of their program, of their 2-year program. So one thing I find kind of dumb is like asking them, what do you know? Assume they know nothing and just teach them everything, because every program is different and you don't want to make them feel like they are inadequate. That is not a positive learning environment. One thing that I absolutely love, and I learned this from Starbucks, is constructive criticism. Starbucks actually doesn't use this method anymore, but I love this method. It's called the what, why. And basically what you do is like, if you see someone, and this is for anything, but the example I'm going to give is like, let's say you see somebody, like, for example, my student was taught to dart injections for everything, not just IMs, which that was the only thing I was taught to dart. He was darting for anything. So the way I like to ask questions for anything is, what are you doing? Have the student explain to you what they're doing. And then ask them their rationale. Why are you doing it that way? So that you kind of get an understanding of where they're coming from. So then you tell them what we're doing and why we do it. So why. So what are they doing, what we're gonna do, and why we're gonna do it. And the reason why is because you want them to, you can't just tell somebody this is how you do it, especially in nursing, and expect them to just get it. You have to have a rationale for every single thing that you do in nursing. You don't just give a medication to give it. You have to know why and what's the rationale. And if you ever go to court, it'll help you to know why you are doing what you're doing. So I like to explain what we're doing, why we're doing it, and the rationale for it. So like, let's say an NG tube insertion, what are we doing? Like, I feel like when I was learning procedures, whether it was a Foley, NG tube, IV, like the little steps always made me anxious. Like, did I do it in this particular way? Like, did I measure? Did I put it in ice? Did I stick it in the right area? Like, did I blow air in through it or check the pH? Like, those little steps that you're taught were messing with my mind. Like, oh my God, is step one. I was too focused on the task at hand than what the procedure actually is. So what I did is, like, whenever I see a nursing student struggle with something, I say, put it down. What are you doing? Like, somebody, especially giving medication when it's your first time and it's like your first semester, you're all like, I don't want to drop the pill, as you're like opening the package and you're like putting the syringe and the needle together and you're like nervous. And I had a student, and I don't want to talk bad because it happens, like you get so anxious, and I was giving a student Pepsid IV, and you know, it has the little cap, and she kept stabbing the cap with the needle, and I was like, stop, what are you doing? And she's like, oh my God. Then she realized, like, I'm such an idiot, like I forgot to take the cap. I was like, it's okay, you're nervous, I get it, you're in an environment you don't know, you probably haven't done this many times before, it's okay. I said, what are you simply doing? I'm giving Pepsi. No, what are you doing? Back to the basics. Like, put them at ease. You are simply opening a package. That's it. That's all you're doing, is opening a package. Pretend you're at home. Open the package. I want to make sure they feel comfortable and realize, like, instead of having high stress and having this thought of, oh my God, I'm gonna give this medication, if I push it too fast, I can kill this person, like I have to make sure this is right. No, like, calm down. Read your environment. Like, you're simply opening a package and giving it to the person. It's exactly how I explain NG tubes when people get, okay, do I have all the necessary things that I need? Like, break it down. What do you need? Lubricant, the tube, the cylinder with the plunger or piston syringe, whatever you want to call it, like Lopez valve if you want that, the suction, like, let's make sure we have everything. But what are you doing? I'm gonna measure, no, stop. I'm like, you're literally putting a tube into someone's nose, down to their stomach. That's it. That's all you're doing. Break it down, make it basic, make the anxiety and the stress of it all go away. That's exactly how I like to teach, because I want them to feel comfortable, I want them to feel confident, and I don't want them to feel pressured. I don't want them to think that I think they're an idiot if they don't get it wrong. I'm the first person that'll tell you I'm not great at IV insertions. I've never been 100% great at IV insertions. I've taken classes, and it's still something that when I hear I need an IV, I'm like, let me get you someone else. So, like, everybody has their own limitations. And I just recently saw, it was so funny, like, this girl, it was a TikTok, she was in the ER, and she's like, I just want all your healthcare providers to know that if you can't find the effing vein, find another job. And it's like, there are so many components to my job that you probably don't realize. A lot. Critically thinking, giving out medication, like constantly monitoring all this stuff. One thing is not going to make you a bad provider. Just because I don't know how to put in an IV, like, I can put in an IV, but whether I get it in the first time doesn't make me a bad nurse. This is how your patients view it, because they don't really know. But don't let one thing that you don't know how to do make you feel like you're a horrible nurse, because it's simply not true. There is so much more to that. And as a nursing student, there are so many nurses who are very good, or nursing students who are very good in class. They know how to read a book, study, and pass a test, but when it comes to clinical, they lack that. knowledge. Like, they don't know how to put that knowledge into practice. And then there's other people who are just not good at studying and passing tests, but they are so smart in the clinical setting, and they are very calm. And I think you have to have a balance of that and teach them that you're not gonna always come across people who know everything. So yeah, I find that TikTok, it was kind of funny because I was like, I think I'm a great nurse, and that's me. I am not the person that is going to be the best, but I will seek you out the person who will. I just don't want nursing students to get discouraged by that. Another thing is a timeline of your day, what you should be doing. I feel like we're never taught as nurses, like, here's this student, teach them what you know today. Like, I don't know what you're learning in class. Everybody is different. Like, every school's different. And when you have 4 or 5 different schools rotating to your unit, it's like, I don't know what you're studying. I don't know what you know. I don't know what semester you're in, none of that. And I don't know what semester your school teaches things in. So what I have a guideline of is I teach my students exactly what I do on a daily basis. And one thing that I feel is important is to teach them charting. And the reason why is because when I was in nursing school, everyone kept saying time management is the number one thing that's hard for you to transition as a nurse. But nobody taught us charting. Everybody kept saying you chart everything. Okay, well, what is everything? I remember being in nursing school and being like, what the hell am I gonna do at work for 12 hours? Like, okay, I get meds and I bathe them, but like, what do I literally do in 12 hours? And my preceptor in my last semester was like, you chart everything. And I was like, okay, but how often do I chart everything? And what do you consider everything? So she's like, I don't want to teach you how to chart because every facility you go to is different. 100% accurate. Every single facility that I have been to, whether they have the same EMR or anything, it's different. However, if you don't if you don't train a nursing student how to chart what you're charting, how are you supposed to just become a nurse and get time management knowledge, which is the number one thing they say is the hardest thing to learn is time management? Why are we setting people up for failure? Like, that doesn't make any sense to me. So every time I get a student, I sit down with them, I give them report, and then I tell them, this is my theory. I look up my labs, my medications, my procedures, my orders, anything that I'm doing today, and I make a schedule. Personally, that's just me. That's not every nurse. Sometimes the nurses just rely on what pops up. I like to be very detailed, and I like to be organized. So this is just my way of doing things so that I don't forget. I write things down as we go, and then I cross things off as we go so I know in my head like where we're at per patient. And then I show them what we're charting. I have Meditech, and I know people don't like Meditech. I personally, like, I don't want to say I love it. I do like Cerner and Epic. I never really used in practice besides in my MP program, but I like those because of the spreadsheets. They're easier to chart and change things. However, I like my version of Meditech that I have because it's so simple. You can copy paste and change what you need. I make sure you're reviewing what you're copying and pasting, but I love that for my version of Meditech, like on the hour, it highlights what you need to chart. So I let my students go with me. I teach them. I chart in the room and I chart as I go because there are some times where I look at my coworker's EMR and it is red. It's like 5 p.m. and it is red from 8 a.m. and I'm like, oh my God, I'd be like freaking out if I was you. So I just like showing them what we're charting, how often and why, so that they know how to kind of formulate your day, because that is the number one thing that people say is the hardest. I like to walk them through what we're doing, how to physically assess. I was in my preceptorship, and I'm assuming this nursing student was a 4th semester student because she's in the ICU, and she asked, how do I do a full head to toe assessment on a patient who's intubated? The nurse kind of looked at her like, what do you mean? You just do it. But I think with the nursing student, like, I feel like that was like not the right way to approach it, but yeah, I can kind of understand where she's coming from, because a full physical assessment from head to toe on a med surg floor is a lot different than somebody in the ICU who's intubated and sedated. So she proceeded to explain like how you do things. But yes, when you're in nursing school, you're taught to ask questions and lift their arms and listen to their abs. I mean, listen to their lungs, their heart, and their belly. Feel everything, touch everything. And you can't really do that with somebody who's intubated and sedated, because they don't actively participate with you. You're not going to ask them to hold their arms out and grip your hands and they're going to give you an answer. So because I'm assuming she's never been in the ICU, yeah, it's confusing. Like, how do I do a neuro assessment on somebody who can't tell me what their name is, what their birthday is, what their date is, nothing like, what date is it? Nothing like that. Like, so teach them, like, you want to be engaging, you want to make sure you're not condescending, and you want to make sure they get the best experience that they possibly can, because nobody wants to go to clinical for 8 to 12 hours and be bored. Like, I used to sit in post-conference and hear like, oh, I gave one med today, and I'm like, that's boring. I got to see EVD insertions, trach insertions, like peg insertions, like do CPR, like going rounds. Like, you have to make sure they're actively engaging. And then you also have to realize that not everybody is cut out for the floor that you are on. And I noticed that because there are some students who come to my unit and they just thrive. They love it. They want to be there. They're actively engaging. And I remember I had a student, one day, and my clerk was like, where's your student? And I was like, I have no idea. And she's like, why don't you go get him? You know, if you really want to work in this unit, if you really wanted to be a nurse, and I'm not going to actively look for you. If you wanted to be here, you'd be following me everywhere I go, wondering what I'm doing, wondering like what we're doing next and why we're doing this for this patient, not just sitting down and looking stuff up to pass the test. So I told my clerk, like, there are just some students who are really motivated, really want to be here, and then there's other students who kind of just want to get what they need to pass. That's up to them. If they want to learn, they would be actively engaging with me. I try to act and engage with as many students as possible and keep them interested. But I can only do so much. You can only do so much as a preceptor as well. You can actively try, hey, want to do this with me? Yes, there's those students that are so motivated, and there's other students who are like, no, I'm scared. Like, try to break them out of their shell. And then there's other students who simply just do not get it, that you have to repeat yourself and repeat yourself until they understand. But I'd rather repeat myself and have them understand than for them to just kind of go there, waste their time, and go home, because I don't want to waste my time and I don't want to waste their time. So anyway, thank you guys so much for watching. Have a great day. Bye.